borders of the Republic of Namibia, and a very warm welcome to today's Cabinet Committee briefing session, coming to you live from the Government Information Center studio. Now, in Namibia, this is a national platform that is initiated by the Government of the Republic of Namibia, emanating from the Government Communication Strategy approved by Cabinet and implemented by the Ministry of ICT. Now, this platform is initiated to serve as a conduit for transmitting information on government projects, programs, policy formulations and advancement, forecast and update, but also strategic implementations within the respective OMAs, that means offices, ministries, and agencies. And of course, the primary focus for this briefing is to fast-track information dissemination across all organs of government. For this morning's episode, I will be your host, Hileni Felepe-Samunyela, and I am delighted to be joined in the studio by the Minister of Health and Social Services, Honorable Kalumbi Shangula, here to brief the Namibian nation on the latest updates pertaining to his ministry. Honorable Minister, once again, good morning and welcome back to the Government Information Center studio. It's always a pleasure to have you in studio. It is over to you.
Thank you very much, dear moderator, members of the media, fellow Namibians. It is a great honor for me to return to the Government Information Center, this time on a pleasant news. This time I come to share with you as a nation, as I was directed by Cabinet, on an important policy development in Namibia's health sector. On the 25th of February 2025, Cabinet approved the policy on universal health coverage for Namibia. I will take a few steps backwards to provide context to this policy formulation. It is said that a journey of 1,000 miles starts with a single step. 47 years ago, in the city of Alma-Ata, in Kazakhstan, 134 countries and 67 international organizations under the auspices of the World Health Organization met and solemnly declared to change the manner in which health care was provided to communities. That conference, whose official title was the International Conference on Primary Health Care, set down the principles of community health in the document that has since become known as the Alma-Ata Declaration. These principles are: 1, availability of health care for all people and at a cost they can afford. 2, promotive and preventive aspects of health care. 3, integration of curative and preventive services. And finally, active participation of individuals and communities in the planning and provision of care. In its true essence, therefore, the Alma-Ata Declaration identifies primary health care as the key to the attainment of health for all. This was at a time when Namibia was engaged in a bitter struggle for national liberation. In fact, the conference took place in September 1978, a mere 4 months after the Kasinga massacre on the 4th of May 1978. Fast forward 3 decades later, the spirit of Alma-Ata was reconfirmed at Astana in 2018, affirming the commitments to the fundamental right of every human being to the enjoyment of the highest attainable standard of health without distinction of any kind. It is known as the Astana Declaration of Primary Health Care. These actions formed and laid the foundation for the articulation of universal health coverage as a public health policy. Namibia joined the international community and started the journey to lay the foundation for the implementation of this groundbreaking declaration. Universal health coverage is part of the Sustainable Development Goals resolutions adopted by the General Assembly of the United Nations on the 25th of September 2015. In September 2019, at the United Nations General Assembly high-level meeting on universal health coverage in New York, His Excellency Dr. Hage Gottlieb Geingob reiterated Namibia's commitment to progress towards universal health coverage. This includes initiating steps to introduce the needed reforms in the health sector and thereby ensure quality health for all, leaving no one behind. As the entity charged with the spearheading the preparatory work to make universal health coverage a reality in Namibia, the Ministry of Health and Social Services created platforms where different stakeholders became part and parcel of the universal health coverage journey through public consultation. We thought it to be a noble goal to enable Namibians from different walks of life to work together to put in place instruments, both policy and legal in nature, aimed at ensuring that Namibian public have access to the quality health and social services they need without experiencing financial hardship. Article 95 of the Constitution of the Republic of Namibia states that the state shall actively promote and maintain the welfare of the people by adopting inter alia policies aimed at ensuring that every citizen has a right to fair and reasonable access to public facilities and services in accordance with the law. This principle is cemented in our national high-level documents, such as Vision 2030, the National Development Plans, the Harambee Prosperity Plans, and our commitments to the Global Sustainability Development Goals, the SDGs. This makes universal health coverage an essential component of sustainable socio-economic development in our country. On the 27th of July 2022, the Ministry of Health and Social Services convened a meeting in Windhoek where we launched the process of developing the universal health coverage policy framework. During that meeting, goals were set out in line with the Cabinet resolution that gave the Ministry of Health and Social Services the mandate to develop universal health coverage policy framework. At the launch meeting, an implementation plan to develop the policy framework was presented, and different technical working groups under the Universal Health Coverage umbrella were commissioned. This was followed by many rounds of meetings, discussions, and engagements to define our vision and what needs to be done to achieve this goal. Meetings were held with heads of offices, ministries, and agencies of government and members of parliament. Engagement were also held with other stakeholders, including development cooperating partners, non-governmental organizations, and civil society organizations, as well as partners in health from the private sector. After its development, the policy framework was reviewed and validated by stakeholders. Throughout the policy framework development process, stakeholders, under the leadership of the Ministry of Health and Social Services, examined what the definition of universal health coverage means to Namibia, assessed progress in the journey towards universal health coverage, and what needed to be done to achieve progress in the attainment of universal health coverage in Namibia. It became clearer along the way that universal health coverage demanded that services should be available to all people who need them, where they need them, and where they need them and when they need them. Cabinet endorsed the policy framework for universal health coverage and directed the Ministry of Health and Social Services to finalize the policy on universal health coverage for Namibia. The policy outlines action needed to accelerate progress to achieve the objective of universal health coverage, as informed by national consensus garnered through the consultative process that preceded the development of the policy. Universal health coverage means that every individual and community should have access to quality and affordable health services without suffering undue financial hardship or financial catastrophe. It also includes access to essential medicine, therapeutics, vaccines, and technologies that are effective, safe, and of good quality. Attainment and realization of universal health coverage means not only lowering but actually removing barriers to seeking, accessing, and receiving needed healthcare services along the entire continuum. This means investing in the health and well-being of Namibians and not only reducing but overcoming entirely the challenges our people face when they seek healthcare services. For example, physical and geographic distances, poor equipment, poor equipped health facility, shortage of trained health workers, inadequate therapeutics and pharmaceuticals, transport for patients who need it, and other aspects. Universal health coverage also means getting needed health and social services associated with affordable care for people receiving them, so that they are able to afford food and other life necessities. It means that families should not be forced to choose between accessing needed healthcare services and their next meal. They should not be forced to choose between accessing healthcare and whether their children are able to attend school. In other words, accessing and receiving healthcare should not place families at risk of poverty or starvation. What exactly is the policy on universal health coverage for Namibia about? At its core, universal health coverage is about people. It is about communities. It's about the most vulnerable and the most at-risk demographics for whom we as lawmakers, we as policymakers, and as implementers must cater for. The work that we have done in the past, the work we are doing here, and the work we will continue to do in the future, it should be about them. Let me now turn to the objectives, visions, and mission and goals of the policy. The overall objective, the main objectives of the policy is to ensure that all Namibians in all parts of the country are able to access the health care they need at all times without suffering financial catastrophe. It aims to promote the provision of adequate quality health services that are affordable and accessible for all. The vision of the policy is that all people in Namibia have equitable access to comprehensive quality health and social services they need without suffering financial hardship. And the mission is to enhance access to equitable, high quality, comprehensive and affordable health and social services by strengthening efficient, resilient, and sustainable health systems. And the goal is a clearly defined pathway to strengthen health system and the enabling environments to Namibia to progress towards universal health coverage and ensure healthy lives and well-being for all. The specific objectives of the policy are to enhance the availability of comprehensive, preventive, curative, rehabilitative, and palliative care services for all people in Namibia, underpinned by the primary health care approach. To provide health and social services that are safe, effective, and person-centered, and which respect and respond to individual needs and values. To ensure that all people in Namibia are protected from financial hardship when seeking health and social welfare services through efficient and sustainable financing mechanisms. To improve equitable access to care by removing structural barriers to providing and accessing comprehensive health and social services for all people. Further, to strengthen health system governance and accountability and promote community ownership of health care. To increase the capacity of health system for resilience and responsiveness to emerging threats and minimize health service interruptions during emergencies. And finally, to contribute to improving the determinants of health for all people in Namibia, underpinned by the primary health care approach towards universal health coverage. The implementation strategies. Strategies to implement these objectives include ensuring access to a comprehensive package of essential health and social services, strengthened tax-funded health financing for affordability and financial protection, and establishing a national health equity fund to support marginalized populations. The ministry will increase health worker availability through strategic recruitment and retention, invest in health infrastructure by building and upgrading facilities, and eliminate structural barriers that hinder access to care for vulnerable groups of the population. This policy's implementation framework assigned the Ministry of Health and Social Services as a central coordinator of the implementation of activities under the policy towards universal health coverage for Namibia. Universal health coverage policy goals will be cascaded and aligned with other policies within the health sector. The Universal Health Coverage Technical Advisory Committee will be established and will comprise senior officials from the Ministry of Health and Social Services, the Office of the Prime Minister, Ministry of Finance and Public Enterprises, and the National Planning Commission. Development cooperating partners, civil society organizations, the private sector, academia, and other stakeholders interested in advancing universal health coverage in Namibia will be co-opted as needed. Reporting, monitoring, evaluation, and learning will be carried out by the Ministry of Health and Social Services through the Policy Planning Directorate, supported by the Universal Health Coverage Technical Working Groups. In terms of advancement towards universal health coverage, Namibia is ranked very high, between 60 and 79% score in service coverage by the World Health Organization. In Southern Africa, Namibia and South Africa have the highest ranking in universal health coverage progress as of the year 2021. What would be the human resource requirement? The implementation of the universal health coverage policy will be carried out through existing personnel within the Ministry of Health and Social Services and other agencies of government as appropriate. Additional human resource for health who will be required to deliver essential health services over time will be accommodated in the periodic reviews of the ministry's staff establishment over the years. The ministry will provide additional fellowship to students pursuing tertiary study in scarce fields and those pursuing various specialization programs to increase the skills available to deliver health service. The financial resources for the implementation activities of the policy will be mobilized through annual appropriation spanning financial years at 5-year intervals. Distinctions has to be drawn between driving the implementation of activity under the policy by the Ministry of Health and Social Services and the resources that will be required to bring about equity to which different stakeholders, public and private, will be required to contribute. Through the proposed National Health Equity Fund, resources will be mobilized to strengthen financing for health and social services through the Ministries of Health and Social Services allocation. Let me take you just briefly the journey and the milestones we have covered. In 2018, the draft paper on policy framework was completed. 2022, the revitalization of universal health coverage agenda following the cessation of COVID-19. You may recall that during 2020, 2021, and towards 2022, the country was fighting COVID-19, but we also made sure that essential services were carried on. But other activities like the pursuit of the formulation of the universal health coverage were not taking place. Then in 2023, broader stakeholder consultation was carried out and the drafting of the policy document. In 2024, the policy was approved by the Ministerial Steering Committee, which is chaired by the ministry, and in 2025, the approval of the policy was obtained from Cabinet. This policy will ensure that all people in Namibia have access to equitable quality health services they need without suffering undue financial hardship. It will promote further investment into the public health sector in line with the adopted strategies such as the costed plan for the mobilization of additional resources for health system strengthening, which was adopted by Cabinet in 2023. This is a significant commitment to achieving the Sustainable Development Goal. Good health and well-being are the ultimate goals of the national social and economic development agenda, contributing to a healthy and prosperous population, a healthy and productive workforce, and a healthier future generations that guarantees socio-economic prosperity for all the Namibians. The approval of the policy on universal health coverage for Namibia by Cabinet marks a historic milestone in our country's health sector, a milestone that will be remembered for generations to come. It is therefore incumbent upon all Namibians to do their part and work together for the full realization of the noble goals and objectives of the policy on universal health coverage for Namibia. I thank you for your kind attention.
Thank you, Honourable Minister, for that comprehensive update on the Cabinet decisions, policy reforms and implementations pertaining to the Ministry of Health and Social Services. And thank you so much, Honorable Minister, for the concerted effort that you and your team of experts have employed to ensure that the nation's health and social needs are catered for. It is really very highly appreciated. Well, Namibia, that is all the time that we had for today's briefing. You were tuned into a cabinet committee briefing session with me, Hileni Philippus Hamunyela. From all of us here in the studio, it is goodbye.